You may have heard of a new treatment for depression called Spravato, or esketamine, which has caught a lot of people's attention because it's chemically very similar to ketamine. In this next video, I'll give you a brief overview of what Spravato is, what treatment looks like, and if it might be a good treatment option for you. Hi guys, my name is Julia Swafford and this is Real Talk Mental Health in Vancouver, Washington, where we talk about real mental health treatment issues from the provider's perspective. If that's content that's interesting to you, we try to release new videos every week, so click that subscribe button and you can click the little bell to know when we release a new video. Today, we're going to talk about Spravato, or esketamine, which is a newer treatment option for depression. And today we're just going to do broad strokes, really just a broad overview of what that looks like in real treatment. Spravato, also called esketamine, was approved by the FDA in March 2019 for treatment-resistant depression and for treatment with acute suicidal ideation. It's actually the first medication approved for those indications, which is pretty cool. Technically, treatment-resistant depression is defined as a failure of 2 or more antidepressant medications, and some insurances will approve Spravato for patients with a minimum of 2 antidepressant failures. However, it's not generally clinically recommended that early on in treatment unless a person is acutely suicidal because it's expensive, time-consuming, and Spravato causes dissociation during treatment. We tend to recommend treatments like TMS before Spravato for most patients because the evidence for TMS, or transcranial magnetic stimulation, is stronger and it's less invasive and less time-consuming than Spravato. However, when medications and therapy and TMS just don't work or don't provide the kind of relief that we need from depression, and Spravato is medically necessary, it's very effective. Studies have shown a 60% response rate to Spravato, and about 40% of people are able to achieve remission from depression even after they stop Spravato. About 25% of people feel significant relief 24 hours after their first dose. Though it's not uncommon for a person not to feel anything for several weeks. But that's really important for someone struggling with suicidal ideation. So, how does Spravato work? Okay, so the mechanism is kind of similar to other antidepressants in that it is increasing a specific neurotransmitter, but it's not increasing serotonin, norepinephrine, and dopamine like most of the antidepressants on the market, like Prozac, Celexa, Zoloft. Spravato targets the NMDA receptor, which increases glutamate levels. Glutamate is the neurotransmitter that can increase brain activity because it's a neuroexcitatory neurotransmitter that can strengthen connections between nerve cells in the brain, form new connections, and help correct malfunctioning neurocircuitry. It can also create long-lasting changes in the brain. Also, Spravato usually causes mild dissociative symptoms for up to an hour after taking it, and that can be beneficial. Patients can use that time to think more deeply and more flexibly about things. It's kind of like cognitive behavioral therapy on steroids. Spravato is always used alongside a traditional antidepressant, and in our clinical experience, it does seem to function its very best that way. Okay, so what can be expected in a Spravato treatment? Spravato is highly controlled because it does produce dissociative effects. So it's self-administered at a clinic, and then the person is observed directly or through a camera for 2 hours at least after the self-administration. It's given via a nasal spray. Patients shouldn't eat for about 2 hours before treatment in case they become very nauseous and throw up. And the patient cannot drive a vehicle or operate heavy machinery until they have had a full night's sleep of the day of Spravato, then a full night's sleep that night of treatment. Okay, so Spravato is started twice a week for a full month, and then the person moves to once a week for 2 more months, and then every 1 to 2 weeks for about a year, and often longer. Some people are in treatment for many years. Because Spravato is relatively new, we really need more research to tell us about the long-term effectiveness of the treatment. Okay, so major side effects. The three big ones to Spravato are sedation, nausea, and raises of blood pressure, and these side effects are monitored directly by the clinician for the 2-hour observation period. All of these would be most likely to happen in that 2-hour period after treatment. There might be some lingering sedation the day of the treatment, which is why the patient should not drive that day. Outside of that acute response and association, Spravato is actually really well tolerated by most patients. It doesn't carry the same side effects as the typical antidepressants like weight gain and sexual side effects. There are some people who are not candidates for Spravato treatment. That includes people who have a history of a brain hemorrhage or arterial aneurysm, people with uncontrolled high blood pressure or hypertension, or people who have active or recent alcohol or other substance abuse issues. Because Spravato is new and kind of expensive, there are some barriers to being able to obtain the treatment even if you meet full criteria. It is approved by most insurances, but it can still be very expensive as far as the copay and coinsurance go, and it can be really confusing for even your healthcare provider to figure out how exactly to get it covered and administered. Because it's a highly controlled substance, it can only be administered at specific clinics that are regulated by the FDA through the REMS program. Also, because it requires the 2-hour monitoring, space for clients at those REMS certified clinics can be sometimes limited. At our clinic, TMS Northwest, we've had the chance to provide Spravato along with TMS for the last 2 years. And I can say that I've really seen phenomenal results with Spravato when it's medically necessary. There might be barriers, but the exciting thing is that insurance companies and clinicians are starting to really understand more about how it works and how to get it covered. And so the availability is growing. Okay, I know that was a lot of information. Bottom line, I just want to make sure that all of you out there know that Spravato could be a treatment option for you. Advanced treatment options like TMS and Spravato do exist, and there are many clinics who offer these treatments and more popping up all of the time as insurance companies and clients and clinicians are becoming more aware of the necessity of these advanced options. I've had the opportunity at TMS Northwest to give Spravato for the last 2 years, and I've seen really phenomenal results when it's medically necessary. If you're in our area, Vancouver and Portland, please give us a call. We'd love to be a part of your treatment team. Please don't hesitate to reach out to your mental health provider if this seems like an option that you'd like to discuss. Stick around for our next video. Thanks for hanging out with me for this video and getting this information, and I'll see you guys next time.